To insert an indwelling Foley catheter, the first thing you're going to do is open your tray after you washed your hands. Take this out, okay, if you can get it out. Okay, this is going to be a trash can, so you can do like this and then put it at the foot of your bed to throw your trash in. Discard that paper. Okay, you have flaps. You're going to open towards the patient. Side, side. Remember, the inside is sterile. Pull out. Okay, this is a drape that you will take out, and you're going to hold only the one outside border, not the top but the sides, and slide it like that, just on the sides. Take your sterile gloves, and you're going to put them on in another location. Make sure you do the sterile glove procedure correctly and that you don't contaminate your sterile gloves. Now you can move this tray a little more working space. Like that should be okay. This drape is useless. Throw it away. Next, you'll have iodine. We're not going to use iodine, but we would in real life. You could squirt your cotton balls to wet them, or it either comes with swabs. You could throw that away. It does come with a specimen container in case you need to get a specimen. I'm just not going to be using that. Tweezers. You have water for your balloon and jelly. We will not use jelly on the mannequins, but you would pretend that you're squirting it here. Okay, you can move this tray a little closer this way, and this one's going to come here. Drop it. Now you're going to hook up your balloon. Holds 10 cc's, or this thing will tell you how much it holds and what size the catheter is. This is a 14 French urinary catheter, and inflate with 10 mLs. Goes here. You can check your balloon or not. There's conflicting information about whether or not to do that. Make sure there's no leaks or broken seals. Make sure you pull all the water back out. Okay. Now carefully take the sleeve off. It will fling around if you don't hold it carefully. So I'm holding it as it's coming out. I'm going to discard that. You will lubricate it. Pretend on your mannequin. And then it would usually stay put like that if it has lube there. So carefully set it down. This doesn't flop and hit the leg or anywhere else. Now you're going to take one hand and contaminate it and hold the labia open. You'll take one of your cotton swabs. You're going to go left, discard, right, discard, middle, discard. At least 3 times. Keep your fingers here. Sterile hand will touch sterile catheter. You're going to keep the labia spread apart, and you're going to insert the catheter into the urinary meatus. Insert about 2 inches is about enough. And then once you see urine, then you advance the catheter about another centimeter. Once you get it in, hold it with the other hand on the outside. Inflate your balloon. Hold pressure, unhook, gentle tug. Now you will apply the catheter to the leg. Put this on the non-moving bed frame part. You're going to document the urine color, amount, consistency, and then you would take your samples. If you needed to get samples, you would have a syringe with you, and you can plug it in here and pull out a sample. To take out a urinary catheter, you're going to use a 10 cc syringe or whatever the amount says to use. You're going to put it in the same spot and it will actually deflate itself. You can pull back on the syringe, it will deflate it, then you can take it out.